My name is Carl Bertram, and I will be presenting on increasing physical activity with the social cognitive theory approach. According to Healthy People 2030, only 1 in 4 adults and 1 in 5 adolescents in the United States meets physical activity guidelines for aerobic and muscle strength training. Therefore, many people are not exercising regularly. This is a problem because physical inactivity can increase one's risk to develop diabetes, cardiovascular disease, cancer, dementia, and many other illnesses. It's very important for people to exercise to maintain a healthy and happy lifestyle. What constitutes the exercise guidelines that must be met? According to Mayo Clinic, you should aim for at least 150 minutes of moderate aerobic activity per week, or at least 75 minutes of vigorous aerobic activity per week, and strength training for all major muscle groups such as chest, back, legs, shoulders, and arms twice per week. What are the challenges associated with exercising? One is time. People complain that they don't have enough time to exercise. Another is the lack of motivation to consistently work out. Another is the lack of finances that are needed to go to a gym. They could be fearful of obtaining an injury, and they may have a geographical disadvantage such that they are not near any recreational or fitness facilities. These are all very common concerns and barriers for people preventing them from exercising. Further evaluation of how these different factors can be addressed when influencing people to engage in physical activity are needed. The theory I will be talking about today is social cognitive theory and how it can be applied to form an intervention for individuals who need to learn how to properly work out and become motivated. This theory was originally proposed by Albert Bandura in the 1960s and was originally called social learning theory. There was a famous experiment Bandura did in the 60s called the Bobo doll experiment, in which he wanted to understand if knowledge acquisition and behavior can be acquired by the observation of others. The study included 3 different participant groups. One sample of the participants included equal numbers of boys and girls, and they watched the male or female model behaving aggressively towards a toy called the Bobo doll. Another sample of participants containing equal numbers of boy and girl children were exposed to a non-aggressive behavior against the Bobo doll. And then the control group was not exposed to any model at all. So the results of the study were that children who observed the aggressive model made more aggressive responses to the Bobo doll compared to those in the other experimental groups. And then those in the non-aggressive group had much less aggression than those in the control group, which did not have a model. So the conclusion of the study was that individuals can learn behaviors through certain cognitive processes and be influenced to complete the behavior after observing some type of model. We can apply this to our exercise intervention because individuals who are unfamiliar how to properly carry out exercises or they lack motivation to can reciprocate the activity of exercising after observing this activity completed and performed by an exercise professional. The central construct of social cognitive theory is, again, observational learning. Other important constructs of the theory are self-efficacy, an individual's belief in his or her capacity to execute a behavior. Outcome expectancy. People evaluate the potential positive and negative consequences of their goals and develop the intention to act. Self-regulation. control, and management of one's behavior through planning, setting goals, and monitoring one's performance. So, in other words, what are the individual's thoughts, feelings, and emotions about the behavior? Are they positive enough such that they are motivated to continue and pursue their goals? And then social support, which is an individual's environment has positive influences on them performing a certain behavior. We can use the constructs of social cognitive theory to develop an intervention to increase physical activity. So for observational learning, individuals will observe fitness trainers and reciprocate the movements of their behaviors. For self-efficacy, we can help build the individual's confidence in exercising through positive feedback from the trainer, reaffirmation that they are improving on their form, and also not giving them too much they can handle at once in the beginning. For outcome expectancy, we can educate and create a positive outlook about the benefits of exercising, such as improved physique, confidence, increase in endorphins, increase in cognition, and overall improvement in their mental health. And then for self-regulation, we can monitor how the individual is feeling throughout the exercise program and keep them motivated to achieve their fitness goals. And then for social support, we can make sure to provide an encouraging environment for the individual of positive influences and surround the individual with positive people at the fitness facility. In terms of the study's design, we want to recruit participants being adult males and females who have a curiosity about the benefits of exercise, could be unsure how to properly exercise without avoiding injury and getting the best benefit, have family members and loved ones who are encouraging them to exercise more, and who currently lack motivation to exercise. So once we've obtained our participants, physical trainers will meet with them one-on-one to assess their fitness level and design workouts that would be appropriate for them. Again, it will be important for the fitness professional to not give the individual more than they can handle because they want the individual to maintain confidence and motivation about exercising throughout the protocol. Also, it will be important for the fitness professional, again, to educate each participant about the benefits of exercising and create this positive outlook associated with exercising. We discussed the main constructs of social cognitive theory, and the central construct was again being observational learning and behavioral modeling. And so participants will observe the exercise movements from the fitness professional, learn how to correctly perform each exercise, and stimulate cognitive processes associated with motivation. Exercises will be split into 5 days a week of 30-minute moderate intensity aerobic activity and 2 days of 30 minutes each of strength training for a total of 3 months. In order to avoid monotony and induce muscle confusion, which is good for overall exercise health, we want to vary the types of aerobic exercises we do per day and the types of resistance or strength training exercises we do per day. The types of aerobic exercises fitness trainers can support participants on are running either on a track in the facility or on a treadmill, having participants go on an exercise bike, and engage participants in water aerobics. For strength training, we can introduce the participant to perform a variety of exercises as well, such as bench press, bicep curls, lat pull down, shoulder press, tricep extension, rows, quad extension, hamstring curls, and either squats or leg press. At the end of each month, physical trainers will assess their fitness level and decide if the specific participant would be able to vary intensity, rep, reps, and durations of their workout regimen. To assess the effects of the intervention, the first thing we can do is provide our participants with questionnaires and surveys to assess self-regulation and outcome expectancy. Some examples of questions we can ask are, how have you been feeling throughout your exercise journey and this exercise program? Have you seen an improvement in your motivation to come to the fitness facility and meet with the trainer to pursue your personalized fitness goals? What steps have you took to meet the physical activity guidelines per week? These are examples of questions we can ask for our self-regulation construct. For outcome expectancy, we could ask, what are your overall thoughts about engaging in physical activity? How has your outlook changed since the start of the exercise program? Do you feel that exercising has improved your quality of life, such as mental functioning, better overall mood, increased ability to perform everyday activities, better work performance, helped you manage weight, and seen improvements in your overall physique? The Likert scale would be used to assess confidence levels and overall thoughts and emotions about physical activity progress. For self-efficacy, we can measure the individual's confidence, for example, by asking how confident they are to perform the exercises taught by the fitness professional, from not confident at all to extremely confident. For social support, we can similarly ask how confident they are to complete the exercise with the encouragement of their family and loved ones and the coaches, peers, and physical trainers at the fitness facility. And lastly, we can assess exercise behavior by the number of repetitions performed by the individual and assessed by the physical trainer. How social cognitive theory can help support an intervention designed for individuals to increase their physical activity can be through stimulating cognitive processes associated with motivation, as well as cognitive processes associated with learning the specific exercise behavior after observing the fitness trainer, helping the individual develop confidence in performing exercise activities, creating a positive and supportive environment for the individual, educating them about the benefits of exercising, and creating a positive outlook for them on the benefits of exercising, and making sure their emotions, feelings, and thoughts are in check to keep them motivated to continue to pursue their fitness goals. Social cognitive theory cannot solve all the problems associated with physical inactivity, and therefore it falls short with a lot of aspects associated with it. One issue could be geographical disadvantages that would make it difficult for individuals to go to a gym to work out, or the lack of fitness professionals in their area. Another could be the lack of healthy food options in their area, which is crucial because eating healthy is important for individuals to be physically and mentally capable to exercise. It is also important to eat the right foods for recovery to stimulate muscle protein synthesis and rebuild muscle. Their socioeconomic status could be a barrier as well for many people, for them to obtain membership at a gym and to buy high quality and healthy food products. Designing specific workout regimens for individuals who have certain medical disorders or conditions that hinder their ability to work out at similar intensities and durations and could be limited by the types of exercises they can perform is also a major barrier. We need to further understand how physical activity guidelines need to be adjusted for individuals who have certain conditions. In regards to solutions for the common problems associated with physical inactivity, For individuals who cannot afford to go to the gym, have a lack of fitness facilities and trainers in the area, and want convenience, we can design an at-home workout for them and use AI software mimicking the exercise behaviors of a trainer. It is true that you do not need access to a gym all the time to work out. You can still get an exercise health benefit from engaging in physical activity at the convenience of your home. There are many exercises someone can do at the convenience of their home without needing to purchase equipment to target their major muscle groups. And so for aerobic activity, they can jog or walk in their area to promote cardiovascular benefits. And then for strength training, for example, one can do push-ups, body squats, planks, lunges, crunches, and so on and so forth. And to properly coach an individual on how to perform these exercises to get the maximum benefit, the software program can be designed to mimic the actions of an exercise professional performing these examples of exercises. And furthermore, fitness trainers could have one-on-one interactions with individuals online to check in with them and ask how they are doing and answer any questions that they may have pertaining to how they can properly perform these exercises. The trainer could even do live demonstrations of these exercises in case they have questions about how they can properly perform certain exercises. In the case of the difficulty in which the individual has specific conditions that limit their exercising, it would be important for their physical trainers to design appropriate workout routines that are highly monitored and approved and discussed with by their doctor. This will require a lot of monitoring and strong communication between the healthcare provider and the physical trainer. Some conditions that impact one's ability to exercise are diabetes, obesity, CVD, cancer, depression, anxiety, dementia, traumatic brain injury, respiratory illness, and so on. For example, for individuals with diabetes, you should start with modest physical and aerobic activity, making sure that their blood sugars are monitored before the exercise, starting off very slowly and then gradually increasing intensity based on fitness performance would be essential for them. For CVD patients, for example, it's important for them to do moderate loads of physical activity with an emphasis on aerobic activity and monitoring their angina and chest pain, dizziness or lightheadedness, irregular heartbeat, and dyspnea. Another example could be for individuals with respiratory disease, and we would want to monitor their breathing throughout activity. We could give them low to moderate aerobic activities to do, such as walking, running, or jumping rope, and moderate weight training to build core strength and posture improvement that can help them improve the tone of their breathing muscles. I discussed how social cognitive theory can be beneficial for an intervention for physical inactivity. I want to compare that theory with the theories of reasoned action and planned behavior and discuss what can be further emphasized with regards to physical inactivity with both the theories of reasoned action and planned behavior. The constructs of the social cognitive theory compare to that of the TRA and TPB because both address outcome expectancy, or how individuals perceive the positive or negative consequences of performing a given behavior. Both also deal with an individual's confidence to perform a behavior. For social cognitive theory, this is self-efficacy, and for the TRA and TPB, this is perceived behavioral control. The difference is that the central construct of the TRA and TPB is behavioral intentions, which are influenced by an individual's attitude to perform the behavior and their normative beliefs, or their subjective norm, which expresses the person's perception of whether others think one should or should not perform the given behavior. For social cognitive theory, People will perform a given behavior after watching a model perform the behavior. And in TRA and TPB, individuals intend to perform the behavior alone if they have the right attitude about it and are influenced by subjective norms. So the emphasis to perform a behavior in both the TRA and TPB is the given attitudes about the behavior and the individual's subjective norm. So to extend an intervention of the social cognitive theory, which its main constructs are observational learning and self-efficacy, it would be essential to emphasize as well the individual's attitudes and how they perceive others in their environment if they perform a given behavior. So if we take exercising, for example, we can promote physical activity in individuals by adjusting their attitudes about it, as well as their social environment, if they are in an environment that discourages physical activity. We can help shape that environment by educating not only the individual, but individuals in their social network about the positive benefits of exercising, which in turn will rub off on them in a positive way to begin exercising.